Okay, I think our second panel is joining little by little. Give another 30 seconds for people to rejoin. I think
discussion in the first set.
Sorry?
I said that was an interesting discussion in the first set.
Oh, thank you very much, Todd. I mean, I really hope you enjoyed. Thank you for being with us there. And I hope that you get some interesting ideas about what's happening in Girona. I think, Danny, we're missing your video and audio. Okay. And Ivan should get back to us right now. Yes.
I'm back here. Yeah.
Okay. Awesome. Awesome. Thank you very much. We are now starting a second part of the session, and it's pretty amazing what a panel we have here. I want to thank you all for finding time and joining me here today. With the high caliber of the speakers, I think we are going to have an insightful and well-rounded discussion on the present and future of the digital passes, and of course, the role of the blockchain, which we already partially tackled within the previous session. But first things first, let's start with the brief introductions. And traditionally, I would like to offer the first word to the lady, to Fiona. And then after, please join Danny, Ivan, and Todd. So Fiona.
Thank you very much, Vasilisa. My name is Fiona Delaney. I am based in Dublin in Ireland. I'm the CEO of Origin Chain Networks, and we provide services to the agri-food sector. We use blockchains to create a trust layer in what it is that we're trying to do. I'm also the technical lead in the ISO TC307 blockchain and DLT technical committee. So I work a lot with use cases. I'm the co-editor of the soon to be published ISO blockchain use cases report. And I'm also co-editor of a new report, which is around data modeling, data flow modeling for use cases, so that we can create a basis for comparison across multiple different sectors and application domains. So I'm really interested to hear more about what's happening in Girona and what the possibilities are, and how blockchain can really maybe accelerate adoption and accelerate our freedom. Fingers crossed.
Thank you, Fiona. Todd, can I ask you to go next?
Sure. My name is Todd Gerke, and I'm based in Seattle, Washington, in the U.S. I'm the chief architect at ID 2020. ID 2020 was started in 2016 as a nonprofit organization promoting privacy-preserving, interoperable, inclusive digital identity. Prior to ID 2020, my background was in software engineering, and the previous 5 years I focused exclusively on blockchain technologies, mostly in the enterprise space.
Thank you, Todd. Ivan, how about you?
Thank you. So my name is Ivan Basart. I'm based closer than my panelists. I'm here in Barcelona. I've been working on the space of digital identity for almost 20 years and in different roles. And in 2012, I co-founded with some colleagues the company Validated ID, which I'm currently the CDO. And we work in different topics, the digital signature, but we mainly also work on digital identity. And from, I would say, 3 to 4 years, we've been working on the field of the self-sovereign identities, so-called self-sovereign identities or decentralized identities, which is basically digital identities on top of blockchain. We've been quite active here. We are members of the Decentralized Identity Foundation. We are also members of the INADBA. So here I have also a colleague from the INADBA. We are part of the Elastia network in Spain. We are also part of the Sovereign Network, which is a blockchain worldwide around identity. So we have now a node running here in Spain of Sovereign. We are working on the EPSI project. EPSI project is the project of the European Commission about blockchain infrastructure and have a specific track record about self-sovereign identity framework. we've been working on the developer track in there. We have developed our own self-identity service, which is called BitChain. We are quite connected with the healthcare because many of our customers of digital signature are from the healthcare, which is mainly our main business. And we are also participated on the COVID credentials initiative, on different initiatives around COVID credentials, which is very related with the problem of the digital identity. I would say it's a specific problem of the digital identity. And recently joined together with the colleagues of ID 2020, the Good Health Pass initiative, which I think is a very important initiative in order to have a big solution of this problem that we are facing with the COVID credentials nowadays. That's it.
Thank you, Ivan, for such an in-depth introduction. And last but not least, Danny, please, if you can introduce yourself.
Yes, thank you, Vasilisa, for this kind invitation. My name is Danny van Rooyen. I'm the co-chair of the Healthcare Working Group at INATBA. INATBA is the International Association of Trusted Blockchain Applications, which was basically founded back 3 years ago maybe, with the support of the European Commission as well. We try to bring together public and private parties around the topic of blockchain. We also have an academic advisory body as well as a government advisory body. And we certainly in the past couple of months have been looking also into the impact of COVID-19 and what role the blockchain can play. In my daily life, I'm the Digital Health Director at COSIR. COSIR is a European Trade Association for medical device manufacturers and software developers. As COSIR, we have been one of the founding members of INATBA. We're also pretty much looking into all spaces of digital health. So I coordinate all activities around AI, cybersecurity, data protection, interoperability. We're a member of the eHealth stakeholder group, which is a formal expert group to the European Commission. On behalf of COSIR, I'm also a member of the stakeholder cybersecurity certification group with ENISA and the European Commission. And I'm very much looking forward to this discussion today. Thank you.
Thank you very much, Danny, and the rest for your introduction. So now moving to the discussion itself. Basically, the idea of the digital passes or COVID passports was there already for quite some time. And just in the previous panel, we were in details discussing the first steps we are as society, as technological companies, as government, taking to pilot such things, right? And Girona is one of the examples, or maybe actually very interesting example. And tomorrow, as we're hopefully going to get some vision of the European Commission on the issue, right? Because they announced this Green Pass initiative, which may become actually a locomotive for the other countries to implement similar standards or framework. But my first question would be to you: we are now rushing to deliver a solution, or many say that in 3 months we have to, before the summer, we have to make it, right? Or at least to bring in the very clear and exact framework for these vaccine passports. And most of you here are involved in the working groups or collaboratives to develop such tasks, such framework. And I'd like to understand from your point of view, what are the most important and key considerations and approaches we should use to create such a digital pass? And I would like to start with Danny, and then I'm sure that both Ivan and Todd, from more technological perspective, will add a lot of value to this question. And Fiona, feel free to add any thoughts of yourself as well.
Well, thank you for giving me this first opportunity. I think there are, of course, many aspects that come together when you discuss about the digital green pass or digital passport. We could discuss for hours about the ethical issues, and surely this will be part of the discussion as well. But maybe starting first from the technical perspective, which I believe will be part of what the Commission will focus on in the legislative proposal, is of course the interoperability aspects. And there they have learned lessons from last year when basically we had the initial COVID-19 outbreak, and countries were rushing forward with their own solutions around contact tracing apps. And this, of course, led to an uncoordinated response in trying to make those systems interoperable across member states. And therefore, already at the end of last year, there have been discussions at the European level around vaccination. And of course, in first instance, focusing on the medical purposes, which is of course very important and also a bit different from the approach when it comes to contact tracing apps. But at the same time, in starting this discussion so early, they would try to, from the European Commission, have a more coordinated response. There are also a lot of eyes looking towards the European Commission, even though they are limited in what they can do, because a lot of what is health related is the national competence. But still, they would like to focus on these things to make sure that we have the principle of a single market and of people being able to travel across borders, which has also been under pressure in the first year of the pandemic, with some member states putting up restrictions or even bans at border level. So of course they would like to open up society as a whole. There are strong restrictions for many people in many countries. So from a society and an economic perspective, there's a lot of pressure. So interoperability will be key to make sure that we have a coordinated approach across Europe. Of course, the data protection and security issues are certainly there as well. And of course, trust elements. What we also saw from the contact tracing apps was, even though all national contact tracing apps were heavily vetted and were found to be secure, there was still low uptake by the general population of these apps. This hesitance may still be there when it comes to the vaccination passport. So this is something they will also need to address. I will leave it at that for the first intervention. Thank you.
Odd, I think you like feel like saying something.
Yeah, I couldn't agree more. I mean, interoperability, I think, is going to be one of the biggest challenges. There's a myriad of applications out there right now to do credentialing and certificates around COVID, and even when you zero in on things like the W3C verifiable credential specification. Even within that, there's differences in the serialization format and the signature formats, and so getting global adoption of just one size fits all is probably not going to happen in this accelerated time frame. And so really what we're looking at is, how do we get interoperability such that, when you're issued some sort of a pass from one application, when you arrive at another country, that they can read it, they can verify it, they can go through their specific regional rules to determine whether or not it's something that they want to accept. And that's a hugely complicated task at this accelerated timeline.
Yeah.
If I cannot, something I totally agree with my colleagues. I think interoperability here is the big issue, but it's not an easy task, because interoperability here, I mean, it's a lot of things. That it's interoperability not just on of the technology layer, but also on which kind of information and in which kind of information, how we handle it. So I think, I mean, I would differentiate two different tracks here: the short term and the long term, right? So I think we will can agree that this COVID credentials problem that we have nowadays facing is part of a bigger problem, which is how we handle our identity in this modern world, right? So mostly we are not owner of our data. So nowadays I cannot, for instance, take my healthcare information from a hospital and move it to my private doctor if I would have one, right? So now we're facing this problem because we're trying to move my healthcare data and moving it to an airport or to another place in order that I can prove that I have been vaccinated or this kind of things. So that's a huge problem around the identity, and the COVID credential is just a part. So the good thing is that I would say that in these last years, with all the work done within ADVA, with the ID 2020, the European Commission, the Decentralized Identity Foundation, many of the things that we are now facing as a problem, a lot of people have been thinking about, and we have some of the work already done. So these are the good news, I would say. But the bad news is that this is a complex problem, and it requires time to have an interoperable solution that worldwide can cover this problem. So I think in the short term, we will see that there will be many solutions trying to solve that in different scenarios. So we have seen the Ubrim Girona in the previous panel. IATA is making a pilot for a travel pass, the Common Pass initiative. There are many of those initiatives, and I think that's great for the short term. It's necessary. Tomorrow, Europe is announcing which is the European solution for that. I'm a little bit pessimistic in that sense. I would say that this would be a solution for solving the problem for this summer. So probably that would be something that would be not very complex in that sense. So that's good for the short term, but I think we have also to think about the long term, right? So we need to this COVID problem, it will not finish this summer. So probably we will have this problem of for many years. And it's not just COVID, probably there will be another diseases and other things that we need to prove. So we need to have a framework able to handle of this kind of problems. So for that, we need to solve many other topics. So I think for instance, in this specific area, the Good Health Pass initiative with ID 2020 is leading. It's very interesting because it's trying to solve this problem as a whole. And I think it's necessary because otherwise we have different applications and not just applications, because we need also to think about that we need to have also solutions for non-smartphones people, right? So there will be people that will not have a smartphone and needs to prove that he has been vaccinated. So, and there's people working on that with technology and with blockchain, but with offline solutions. So I think it's a very complex problem. So the golden hammer, nobody has it. So I think we need short-term solutions, but we also need to work on this long-term track, which is complex, but I think it's necessary to be worked by everybody. Sorry for this not so short introduction.
Thank you, Ivan. Fiona, I can see your hand.
It's really interesting. So from my perspective, from a use case perspective, and what we've learned from the application of use cases across multiple domains is that blockchain developers and blockchain applications have not been very good at integrating existing industry solutions to the identity problem. So as Ivan rightly said, there is an important element, particularly in Europe, of self-sovereign identity, and that's typically deployed as a kind of a layer, separating for reasons of privacy, the identity of the individual from their reference identity in an application. That's a really powerful step, and it's a real enabling factor. But what we don't have, and this COVID pass is right in the middle of it. There is no such thing as a universally accepted passport, and there is no requirement in any state that every citizen has a passport, right? Human beings are not chipped. So there is no way of associating the human person with even their device or their passport or anything else, a certificate, a birth certificate, whether it's a piece of paper or something that's digital. So these problems can be, as Ivan suggested, we can see it as a problem or we see it as part of the solution, and see in a highly integrated and innovative approach that there will be multiple solutions. There will be multiple types of interoperability. It's not just about technical interoperability. If it was, we could define it and propose incremental solutions because we could bound it. But actually there's governance interoperability, there's legal interoperability. Certainly when we're talking about cross-border migration of people, human beings, which Europe is facing well-recognized problems around its borders, Schengen, migrant workers, all sorts of different types of movement of people, whether it's for tourism or work. And all of these different types of applications are going to require different types of solutions. And I think what's really interesting is that Girona, in leading the way and proposing a solution that resolves both, either we can see it as solving problems for the population within Girona, where people in Girona can go to football matches, can go to the theater, can travel and see each other, or we see it as the city opening up for tourism. And on the basis of, these are a list of agreements, these kind of people can come in. If you meet these agreements, you can come in and come for a holiday here, if that's what we're talking about. It's not clear, actually, how far we can go with it, right? So I can see so many different possibilities and so many different applications that I think, as a software developer myself, I'm always like, identify something small that you can solve and do that really well. And I think while the Girona pathway forward seems really big, as Ivan suggests, it's time bound. We can identify the specific needs for right now. We can calculate where existing identity systems that might not even be digital, where the shortfall is, and then apply what we can with this decentralized methodology, solutions and software, and fill the gap. That, you know, create a pathway where we are using and harnessing technology to bring ourselves back together, to start to commune together again. So it's absolutely possible. I think we need to be careful about where we put the boundaries of something, because while interoperability it's massively, massively important, the other side of it is around monolithic proposals, which then create kind of vendor lock, or you've got to go with one type of solution, and that creates another kind of buckets or dead ends, or lacks agility, actually, at a certain point. And what we have seen, as Salome suggested in the previous presentations, that things are changing. All the cogs are moving all the time with this, both regulation and legal. The technical side is moving ahead. Even technical adoption and this idea of technical or digital exclusion has diminished somewhat. I think it's very difficult to put a number on that. So yeah, it's a lot of moving parts, and I think it's going to take collaboration between those existing identity systems, existing trust vectors, and what's newly possible, or relatively newly possible, with decentralized ID, with blockchains, and with decentralized applications, with decentralized governance.
Right, yeah. Well, basically, I mean, what most of you have mentioned, besides the quality of, or like, let's say, points we have to take into account for these digital passes to be created, is actually its interoperability, which is super huge issue. That's exactly like the COVID is a global issue, but to find a global universal solution, and find the consensus, reach the consensus between all the bodies involved, different cultures, even different countries, different regimes, it's especially hard. So that's why I think that, for example, this collaborative work, which is done, like, for example, by the Good Health Pass Collaborative, right? Which is led by the ID 2020, is super important, because you're trying to bring all the parties on board. Anybody who wants to participate can be involved on different levels, on more active or less active, but at least being involved in that, right? So, and the same which INADBA is trying to do, again, to bring more different parties to collaborate, to work out solutions together. So I would like just, if you, Danny, and you, Todd, can briefly outline like your agendas for what you are doing in your groups. Maybe if I can suggest that after this call, I will get you connected, and we can bring this work together to be more aligned. So Todd, if you can start a little bit with explaining.
Sure. I mean, I'll talk a little bit about what we're doing with the Good Health Pass collaborative, in that, you know, we realize that there's fragmentation in the industry, and that there's a collection of problems. I mean, you know, it's not just once we agree on a standard format for what the pass looks like, we can't declare success. You know, and they brought up a lot around the point of identity. So one of the working groups or drafting groups in the collaborative is working around identity binding. How do we bind the individual's identity to the pass itself? And we're not in a world where we have ubiquitous self-sovereign identities. We don't have digital identities that make that really simple. And so you know, we're in a world where the pass is going to have a certain amount of personal identifiable information that you would compare to a physical ID, like a driver's license or a passport. And we know in the long term that may not be ideal, but that's kind of where we are. What we've done with the Good Health Pass initiative is we've tried to break it up into 7 distinct working groups. You know, the first one is trying to look for a consistent user experience. The second is around data models and standard elements that we feel that the pass is going to need to have. At the same time, when we start talking about the standard data elements, there are other groups that are already doing some of this work. The WHO is working on a smart vaccination initiative, and that really is a spin-off of the digital yellow card that they had been doing for even before COVID. And so we're looking to those other groups to sort of define these data models and trying to bring them together into this collaborative so that everybody can share information and look for consistency so we can get to interoperability. You know, and then I mentioned before the credential formats. We've got a big collection of different solutions that are rendering credentials in different formats. And, you know, how do we make it so that you don't have to get 3 different passes in order to travel, you know, one to leave Singapore, another one to arrive in the US, and possibly even a different one for any venues you want to attend. There's a working group on privacy and data protection, another one on trust registries. And, you know, we look at trust registries as really being more of a solution, but really getting trust registries that are going to work across a collection of solutions is something that we need to address as a community. And there's not going to be just a single trust registry that you go to. It's going to be by jurisdiction, where they create other criteria that you need to enter countries, which brings up another one where we are looking at, you know, which rules, how are we going to manage rules per jurisdiction? And the final group is around identity binding. How do we tie that credential to an individual? And each of these working groups is we're actually calling them drafting groups, is coming together to create a position paper and collectively trying to get feedback from all of the people that are working on this problem within the various parts of the industry, you know, governments, healthcare, as well as the technologists, to publish something that we can all go to use as a as sort of a blueprint for what we can strive for in the long term.
Thank you, Todd. Danny, I know that you wanted to add, but actually that was my plan to actually giving you the word.
Thank you. Maybe just referring to what we have been doing from INADPA. Last year, at the start of the pandemic crisis, we teamed up with the World Economic Forum. We also set up a task force in looking for solutions that could be of help to national authorities. At the time, we did a kind of internal pitching, where based upon that, we put forward a number of solutions that were provided by our members to this platform in order to organize kind of matchmaking. Out of that came a kind of spin-off project where there was a cooperation between INATBA and university looking into building this into a more permanent project to have this liaising with countries. What we looked at the time was for these solutions, to what extent they were scalable, mature, and to what extent they were part of an ecosystem, how complex the ecosystem was, because as was mentioned before, you're operating in a quite complex environment where a lot of different players come into stake. We approached this in a similar way now. Last week we organized a first event around COVID-19 vaccination delivery and tracking. We also did a similar exercise with members, and of course, because we have a 1-year experience now with COVID-19, we felt that the solutions being proposed were much more mature than what we've seen last year. Several of them were already being tested or piloted. An interesting one as well was one that was done together with the European Blockchain Service Infrastructure. So this was a first step. We have bi-weekly calls with our working group, so we will further evaluate how we can build upon this. But of course, we are very much interested in work that takes place with WHO, and of course also the initiative that is being set up around the Good Health Pass. It's very valuable work. If I come back to something that was mentioned earlier around the interoperability, I think Fiona had some very strong points around interoperability and the kind of multiple layers that are there to overcome. If I can refer back to the contact tracing apps, that was something very simple in a way. If you look at it from an interoperability perspective, because at the European level, there was agreement at the kind of what are the conditions for kind of considering a high-risk contact in terms of when you have been into proximity of 1.5 meters for 15 minutes, then it's a high-risk contact. And the only exchange you had were random identifiers between systems that are being passed along a European gateway service. If we look now into this whole issue around the digital passport, it is much more complex also because you could consider the contact tracing apps in many countries to be a kind of standalone solution that were coming top down from the national authorities. Whereas if we look to the challenges of these digital passports, now basically the public and private actors looking into this. The health systems are different, the vaccination strategies are different. So in some countries, it will be actually the kind of national authority that validates and authenticates the fact that you had your vaccination. In other countries, it might be pharmacists as well, it may be doctors, maybe other personnel as well involved. There's also the possibility to register tests, so there might be other persons involved. So it will create additional challenges around the identification, the authentication, and also feeding that information into a public health system is also very, very different from just sharing a random identifier, because healthcare is mostly a local issue. So there's a strong historic background there, and it's very difficult to integrate these issues into existing systems. And this is something that, of course, will be now up to the different initiatives to see how they can sort of get this interweaved with the public health systems. So that, as was raised by Ivan, that we're not only focusing on the short term, but also on the longer term in terms of how to make this data available, how this can be audited, how this can be used also for public health systems to evaluate. And certainly, as we're still pretty much in the early stages of the pandemic, there are new variants coming up. It's quite unclear how long immunity will last. I recently read about a new variant that is more difficult to track. So this is not sort of like, okay, we know what it is and we have the solution and let's start from there. No, it will be an ongoing process where we need to go through iterative steps to ensure that we have a robust system that tackles all these different challenges. Thank you.
Thank you, Danny. I mean, I think that in terms of interoperability, again, it's like it's the whole conference of the full day we can dedicate only to this issue, especially what Fiona was rightfully mentioning, that we're not talking about technological interoperability, but all kinds of that, right? And regulatory, logistics, anything which we can think of. But I want to turn our discussion a little bit towards blockchain and technology-wise. Some of the initiatives in terms of the digital pass, not all of them, not in all the countries, but some of them are very much heavily advocating for the use of the blockchain technology for this type of the passes, especially taking into account the recent developments in the space of the self-sovereign identity and zero-knowledge technology, which is widely like getting popularity, especially here in Europe. I assume similar things happening in the US. But from your perspective, how ready is the technology to accommodate COVID need? How scalable it is? And if I can ask this to Ivan, because he works with this like daily.
I'm suffering this. Yeah, that's a very good question. I mean, we are focusing a lot on interoperability because I think it's a super necessary thing in this scenario. But of course, we must think also about privacy and about security and about scalability, right? And there's a big challenge here because mostly on these short-term solutions, right? Because we may have that some solutions are quite kind of Google or Facebook style, right? So kind of a central state controlling all the healthcare data of the citizens, which is quite scalable, let's say. It's not so much private about privacy and security. And also, if we think about the extreme interoperability, I would say paper is the most interoperable system we already have the humans in our lifetime, right? So and probably most of the solutions we will have on the short term will be paper-based, and maybe it's a trade-off we need to have for this pandemic and for this short term, right? But if we go to this long term, we need to think about this security and privacy by design and all these kind of things, and to be aligned with GDPR and all this legal tech. And in that sense, blockchain, I think it's a very useful root layer on that, right? So if we think about the self-sovereign identity, it's like, let's say, internet, you have like different layers. And to be honest, blockchain is just a thin layer on the self-sovereign identity, but let's say the first layer. In most cases, there are some solutions without blockchain, but typically you have this layer because you need somehow like a decentralized systems that is not controlled by anyone, right? That allows that it's neutral, that it cannot be blocked by anyone, right? And for that, blockchain it's very good. And here there are different approaches. There are people that it's based on public blockchains, right? And here you are facing things like scalability, like costs that are not fixed and these kind of things. And there are different initiatives here, like layer 2, in order to reduce the number of transactions you're putting there. And there are some other initiatives based on permission that a blockchain, that for instance, the European Commission. To be honest, I'm not favor for one or the others. I would say there are pros and cons on some of them, and it may depend on the use case. There is, again, no golden hammer for that. The important thing here is, again, that the solution that are built on top of that needs to be interoperable with different kind of ledgers and different kind of approaches, because at the end, user doesn't care about blockchain or which technology you are using on your, I mean, we are exchanging emails that user is not so much interested if you're using IMAP or POP3 or which kind of protocol, right? So you are using that you send a message and the message received to another person. So here the technology is important in order to be sure that, okay, my data is there. It's not in blockchain, by the way, but I would say my data is controlled by me. I can be sure that it's private. I can be sure that I can exchange the data to this person, cannot be disclosed to these other kind of things. And for that, technology is good, but it's not just about technology. It's also how we apply and use technology. And I would say, again, there's a lot of things happening around there. It's not yet something mature or close, but there's a lot of people working on that. Again, the Decentralized Identity Foundation, W3C are standardizing some these kind of things. And it's another stack of interoperability that we need to work into. And it's happening, by the way, on the decentralized identity world. If we look at what's happening on the last months, I would say there is like more horizontal track where there is people working on this common layer on standardizing these kind of things. And there's a more vertical track, the people working on specific use cases, like what we are discussing nowadays on healthcare. There's people working also on human resources, on other specific use cases, because there is a interoperability and security problems in those different axes, in this more common or transversal layer and also this use case layer.
Thank you, Ivan. Anybody want to add something on that?
Yeah, I mean, you know, interoperability seems to be coming back in, you know, at every response. But you know, I think we were looking at is decentralized identity and is self-sovereign identity ready, and can it scale? And I think that it is. The challenge is interoperability again, but you know, one of the other challenges is when we start talking about the data sets that are being put forward. It's on the healthcare provider side, on the issuer side, it's very healthcare focused, and with the WHO, they're driving toward two goals, one being proof of vaccination and the other one being continuation of care. And so when we bring together these two different use cases, we end up with more information in the credential itself than what we might need to just prove our vaccination. There may be some other information that a healthcare organization would need for follow-on care. And so that brings forward some of the technologies like, you know, selective disclosure, being able to say that I'm only going to present certain attributes of my credential to the verifier, and then also the zero knowledge proof, the yes, no, I have a vaccination, I'm not going to tell you anything else about it. And both of those technologies are available and scalable because they're all done in a decentralized manner. They're done on the device, and then sent out to the verifier. So, you know, the architecture that's been put forward for decentralized identity does lend itself to the scalability and the global size of the problem. Where it really becomes challenging is when we talk about paper-based credentials. I mean, there's a lot of people looking at, like, how do we take some of these digital capabilities and create a similar experience when we have paper, and it's not going to be the same, at least in the short term.
Yeah, it's like, what if you want to be digitally free? Fiona, I saw your hand. Please take a word.
Yeah, so Todd, I taking it from this sort of higher level blockchain view, not so much on the healthcare side, but similar issues. Essentially, what we're doing in decentralized governance is facilitating the co-creation of a novel data set. And what we are asking citizens to do here is to co-create their COVID pass whether it is in the existing app that I downloaded from AOK, essentially what you're doing is taking a photograph of your ID, and that becomes part of a suite of documents that's what I saw on their existing one. I'm not saying that's what's happening in the Girona pass. So this is a big shift for users. So we're not just talking about digital usability, we're talking about workflow or business process comprehension or cooperation. So we're asking citizens to essentially co-create and administrate their health pass in this instance. And we can see that as an immensely empowering thing. That's a bit of a change, you know, as Ivan already mentioned. It's not easy to get our medical records from, you know, Dr. A to hospital B to something else at all. And now here we are responsible for collating and co-creating this record for ourselves. And then we're trusting this system to share our information in a kind of zero knowledge proof way that we can trust. And the shift there is actually, the cultural shift there is phenomenal. And there is, so we're talking about this new kind of innovation and new opportunities and new kind of interoperabilities. But what will happen is with this shift are new opportunities and new types of governance that we can't even predict really at the moment. So I find it's really, really exciting to consider that shift. And I would take this opportunity to invite you all, because I know some of you are already involved in standards development in ISO TC 307 and WG6, which is focused on use cases. There is the subject and object identifiers report is being compiled at the moment. And I don't think we have a particular focus on healthcare. So I think maybe tracking this project could be a really interesting way to involve it in emerging standards development in terms of facilitating those types of interoperability. So if that's something that we can continue this I don't know, this discussion or just bring forward this knowledge sharing, I think there's a real opportunity for us to do that. And similarly, I would definitely encourage you, Vasilisa, to submit a use case, write up the Girona Pass use case for the ISO repository, because that becomes part of the CEN repository as well for blockchain use cases. And it becomes a resource right across Europe for other developers, business developers, software developers to learn from each other and continue these conversations.
Fiona, I mean, thank you very much for such a comment, and especially regarding the ISO in the report. That's a brilliant idea, and I wouldn't say that I was even thinking of that, but it's a brilliant one. I definitely will catch up with you offline. Well, still online, but but outside of this conversation, because we don't have that much time, and there are a couple of questions which I still want to discuss with you guys. Ivan, I see your hand. Do you want to add something?
Yeah, very quick to the shift that Fiona was mentioning. That it's completely true. It's a shift, but it's a shift to the origin, by the way, because we already have this power on the physical world. So I'm the owner of my papers and my documents, and I present the documents I want to the person I want. So it's that somehow when we go on to this online world, we lost control of our data, right? And we are now using it too, right? And we think that's quite crazy that it's happening, but at the end is what's happening on the physical world. So I think the user will be very used to this kind of things because it's just a matter of time, because we already what we are doing on the physical world, but on the online world, right? But it will be a shift, of course.
Thank you, Ivan. Well, actually, just adding to your point, when you've been talking about the documents which we present, especially when we talk about the passports or driving license, I'm not sure how in different countries, but I'm sure that in many countries, if you read the little letters downstairs, it actually says that this document is a possession of this government, not of this person. So actually, the passport, the right, a Russian citizen because it belongs to Russia, not to the citizen. And that's why actually the other country or authorities of the other country has no right to expropriate it from this person because it's not his personal belonging. Just to make a comment, you know?
Yeah, sure. But I would say it's not so much about belonging. So it's about control, I would say. For me, it doesn't care who is the owner of the credential, but I would like to the data around it. I mean, it's about me. So I mean, of course, the one has issued my credential can have the right to revoke it, right? And it's something that needs to be also, by the way, designed to revoke credentials, not maybe on the healthcare, but in other scenarios, we'll need to revoke credentials. But at the end, I have the control on what's happening, right? Today, the problem is that it's not just that I do not control my digital information, is that I don't even know which is my digital information. I have no idea which information has about myself, my government, my bank, so I don't think about control, but just knowing it, right? So I think that's the big shift.
Yeah, I mean, I'm afraid we are very much unaware. Like some of people are and they're conscious about this, but most of the people are not. But anyways, it's like again, being conscious about time, and few other questions which I had for you guys. So something which actually Danny was mentioning in the beginning, and I want to address this question very much because it actually raised some discussions even before this panel when we published that we're going to have a D4A pulse in our Telegram group. The discussion was happening quite intense. So what worries a lot of people, both I think WHO and European Commission are trying to address, is the question of inclusivity and ethics, right? So are these measures to introduce such digital, especially vaccination passport, how ethical they are? What are your considerations here? What is your view here?
Yeah, it's a very delicate exercise. On the one hand side, people see these passports as facilitating in a more easy way access in and out of countries. So in a way, you could see it as a kind of fast lane approach, and there are certainly also questions around that. But at a certain point, if you go a bit more granular, and let's say, for instance, the project at Girona level is very interesting as well. If you go to a more lower level in terms of can you go to a cinema, if you can go to a restaurant, and would you be excluded if you cannot show your passport? Those are the kind of questions, and certainly there are people that are not willing to be vaccinated. At the same time, some people do not have the opportunity right now because of the vaccination strategy and the availability and accessibility to that. So some people may have to wait for years. I mean, certainly we have been discussing a lot within Europe around the availability of the vaccines and how slow everything goes. But if you look into low and middle income countries, I mean, there are some countries where they haven't seen any vaccine yet, or have to wait for a few months, or only seen like 1,000. And certainly, if you talk more about the global response, how would you deal with that? Can you just shut out countries for years for international travel? So it's very difficult to find a balance there. And if we just look to other legal frameworks that we have in place, there's always a difference as well between, on the one hand side, what's in the law and what takes place in practice. And if you will go to a restaurant and somebody is standing at the door and he says, can you show me some evidence? And you say, well, I'm fine, or I have this passport, but he's not accepting it, he will not let you in. And of course, there might be some way to address this, but this probably you will not do it, or it will be too onerous, or it will take too much time. So there are many ways that people can be sort of excluded from daily activities even. So that is something which will be very hard to address. Certainly, if we look to the fact that, like with the contact tracing apps, this was top down. This was coming from national authorities. For instance, there has been a lot of discussion around tourism, international travel. So this is not the typical kind of authoritative players you see there. Of course, there are international associations that have a strong backing, but still this may run counter to your personal rights and freedoms, and may look more towards the commercial interests or the business interests of those that are supporting this initiative or making use of these credentials in a certain way. Thank you.
Thank you, Danny. I think that was quite comprehensive evaluation of the situation we have. Anyone wants to add anything on that? Yes, Fiona, I was waiting.
Yeah, this is maybe a little sidebar, but when we consider that we've all been talking here about how useful the Girona project is as a pilot, and you know, all the unknowns that may arise out of that. My own, one of the organizations I'm involved with, Block W, which is a female-led kind of technology advocacy group, with a kind of interest in that idea of digital sovereignty and the digital citizen. I wonder, is there a way, as you've done here, Vasilisa, is to reach out and share the knowledge with those independent groups, you know, right across Europe? What are the emerging concerns and the emerging opportunities for different cohorts, whether it's older folks or children, or, you know, seeing that kind of reach and knowledge sharing across multiple demographics and geographies. I just wonder, in terms of information sharing, is there a way that can also be facilitated?
Well, in terms of Open Girona project, I would say that, again, I was saying that in the end of the previous session, we are very much open to share the information. We want the observers, we want the contributors, we want us to be a part of something bigger, right? Because it's important. How the question of facilitation is a second question, right? It's that we need to build these bridges. We're trying to build the bridges from our end, but it's, again, sometimes we can oversee something, right? Or we are overwhelmed with things happening around us, and it's important that people also reach and, you know, raise their hand and say, hey guys, we are interested. Are you wishing to collaborate? Well, our answer will be like, I don't know, 99% yes.
Yeah, and actually, I don't even think it's fair to, with all of the work that's ongoing in a single project, how can you also be responsible for sharing that out? So I guess I just wanted to raise the issue, because there are so many organizations and so many interested parties, and that it is important to bear that in mind for all of us. I guess to share what is happening, for all of those reasons we've already talked about: the speed at which things are changing, the rise in, let's say, COVID denialism, if that is a rise, or maybe we're just coming to see it now with vaccine refusal or other actions, you know. And it cannot be the responsibility of one project to try to address all of that thing. But we are in a society, and this is important to society, and there needs to those bridges need to come from they need to be pursued.
Well, that's it's very important, I think, for general success of not just the Rio Girona, but the whole idea is a very intense collaboration and information sharing. There is no anything that it's like keep it to yourself. It's a very global issue, and there is a lot of work to be done, which cannot be addressed by one company or by one person or a group of people even. It should be very much inclusive in that case. That's why we as well, we're working with the different organizations. We are part of a Good Health Fast collaborative as well. We are joining in ADBA as well right now to be as much present. Like, I really like the idea about sharing this with the ISO and to make the report on that, because again, for us, it's most important that we showcase what we're doing, and we are very much eager to receive any advice, any comments, any issues actually raised, so that we can think of them. You know, it's consultancy after all. So we're pretty much done with time, but I had just the last question, if I may. I hope you're still there with me. Basically, what was mentioned, and this question basically comes from what was mentioned several times, especially by Ivan, about the short term and long term. So how do you think, putting it very straight, this initiative with the digital passes, is it something we're gonna have right now because it's needed, right? For example, like during the lockdowns, we had, I don't know, different countries had different things, but somebody needed to sign a paper to go out for a shop. Somebody needed to receive a special code by the SMS. and that was there for 1 month or so, and then it was gone. So are we going to use the pass just for fighting the COVID when we have everybody are mostly vaccinated, when the pandemic is over? This initiative is going to go down as something redundant, or actually this is here to stay with us? It will just take some other turn, and it will start to collect more information and different type of information, not just health one, but also will become a standard for travel. So what do you think about this? What risk opportunities you see here? Ivan,
super short from my side, because we are out of time, but I think that's coming to stay, probably not in the form that we are having nowadays. That will evolve, that will change. We need to learn all together that. I think that's a big challenge, because I would say at the beginning that's a part of a bigger problem, which is about the management of our data. So I think that's going to be probably the excuse to the rest of the problem to something that it's going to be accelerated. And I think it's very important, as Fiona said, the feedback we have from the pilots like Ubrim Girona and others that are doing with real users, because as it's already super important the work that we are doing in INADVA and in Good Health Pass and COVID Credentials Initiative and others, right? But we also need the real touch, which is the feedback of the people using that, because sometimes the theory is one, but when you go to reality, right, you see that it's something that it's not working by any reason. So I think it's important working in these two tracks, in this building this big idea, but also having the feedback of these pilots that are happening on the short term. But I think that's gonna come to stay.
Yeah, thank you, Ivan. Todd, any?
Yeah, I agree. I think that it unfortunately it is probably going to last beyond this COVID problem. Unfortunately, I think that it introduces a lot of risks. I think that we're moving really quickly, and we need to look at the ethical and the exclusion issues around something like this. I think it's also really important to realize that a lot of what we're doing right now is all around global travel. And when you're traveling globally, you don't have the same civil liberties that you do in normal life. And so we're building these applications sort of in a context and with a use case that doesn't consider some of the really important factors. And that, I believe, is not a good thing. And hopefully we'll be able to slow down and be a little bit more measured as we move forward.
Thank you, Todd. Fiona, yes.
Really quickly, I think what we should consider is an idea of disposable identities for this purpose, for something like this. So if you go to Istanbul for the weekend and you get your public service travel card for the weekend, you know, maybe that has like an inbuilt COVID vaccination information, and you're there and you can, you know, use the tube or the bus or the tram or whatever, and then it's kind of closed off. There's not this historical record of where you've been and all that kind of stuff, so that you're really preserving your privacy for any number of reasons that you could care to think about, but that you've got this concept in the same way that we have in blockchain wallets. You can create a brand new ID just to receive a payment, or to share this piece of information, this little bundle of info. You create a new ID and you can suit yourself. And I think we can bring the best of what we have around anonymity or around privacy to satisfy really the strict parameters of what that data sharing information is about, to protect the rights of the, let's say, the travelers. Because, for example, there are some nation states, if you have ever traveled to, and if you have the stamp in your passport to, I'm not going to name countries, but you can't get into another country, or you will find it difficult to get into another country, for example. So with something like this, you don't need to leave digital traces.
That's a very, very interesting concept, and actually very useful. I'm not sure, again, how fast it can be implemented, though. And I think, Danny, the last word to you on that.
Yeah, just as a quick comment, you know, the historic joke, do you need blockchain for that? The answer is probably no. And the same with digital passports. Do you need digital passport for that? Probably not. So I think it would be a healthy reflection once this pandemic is over that we can sort of return to the new normal where it's still not normal to go everywhere with a digital passport. If you want to travel to certain countries and you need to have your vaccination for malaria or dengue, whatever, then of course a digital passport could make sense in future and it is a logical step. But in terms of having additional features linked to that would be a very slippery slope. That's my recommendation or final conclusion to this. Thank you. Thank you a lot.
Thank you very much, Danny. Thank you very much, everyone. Ivan, Fiona, Claude as well. I think it was a wonderful panel. We covered so much, and actually, I'm sure that everybody who were listening were like fascinated by the discussion. And it's a very, in part, aligned view of the experts. And at the same time, we tackle lots of challenges we are facing right now. So thank you very much. And very sorry we ran out a little bit out of time. So guys, bye. Have a great rest of the day for you. And I hope you're going to be joining our events in the future.
Thanks so much.
Bye-bye, everyone.
Bye-bye.
Bye-bye.
Bye.
Thank you.